Hello everyone, I'm Dr. Sandeep Nagre, and today we're discussing a topic that's becoming increasingly important as our population ages, polypharmacy, or the use of multiple medications, particularly in the elderly. As we age, our bodies change. We might develop new health conditions that require medication. It's not uncommon for older adults to be taking multiple medications at the same time. This is what we call polypharmacy. Usually it is related to 5 or more medications. Sometimes it's necessary to manage complex multiple medical issues with multiple medications. However, it can also increase the risk of problems. These can range from unwanted side effects to dangerous drug interactions. Imagine a loved one taking several different pills, each prescribed by a different doctor. They might not be aware of how these medications interact with each other. This can lead to confusion and potential harm. That's why it's crucial to understand polypharmacy and its implications for our aging loved ones. We need to be proactive in ensuring they're taking the right medications safely and effectively. There are several reasons why polypharmacy is more common in older adults. As we age, we tend to develop more health problems. This often means taking more medications to manage these conditions. Think about it. Heart disease, diabetes, arthritis. These are just a few common conditions that often require long-term medication. It's easy to see how the number of pills can add up quickly. Additionally, older adults might see multiple specialists for different health concerns. Each doctor might prescribe medications without fully knowing what else the patient is taking. This lack of coordination can contribute to polypharmacy. Furthermore, some seniors might be taking medications that are no longer necessary or even harmful. This can happen if medications are continued for longer than needed or if a previous condition has resolved. It's like having a medicine cabinet full of old prescriptions. Some might still be helpful, but others could do more harm than good. That's why regular medication reviews are crucial for older adults. While medications are often essential for managing health conditions, taking too many can lead to a cascade of problems. Polypharmacy significantly increases the risk of adverse drug events. One of the most concerning risks is drug interactions. When multiple medications are taken together, they can interact in unpredictable ways. This can either reduce the effectiveness of some medications or amplify their side effects. Imagine taking 2 medications that both lower blood pressure. Individually, they might be safe and effective, but together they could cause a dangerous drop in blood pressure, leading to dizziness, fainting, or even falls. Speaking of falls, polypharmacy is a major risk factor. Certain medications can cause drowsiness, dizziness, or balance problems, making seniors more susceptible to falls and injuries. Managing polypharmacy effectively is crucial for ensuring the health and well-being of our aging loved ones. The good news is that there are several strategies to minimize the risks and maximize the benefits of medications. One of the most important steps is regular medication review. This involves meeting with a doctor or pharmacist to discuss all the medications a senior is taking, including prescription drugs, over-the-counter medications, and herbal supplements. Think of it as a medication checkup. During the review, the healthcare provider can identify any potential drug interactions, assess the appropriateness of each medication, and make necessary adjustments. Another important strategy is deprescribing. This involves safely and gradually discontinuing medications that are no longer necessary or might be causing harm. It's not about stopping all medications abruptly, but rather about carefully evaluating the need for each one. Deprescribing might seem counterintuitive at first. After all, we're often conditioned to think that more medication means better health. However, in the context of polypharmacy, less is often more. Deprescribing isn't about denying necessary treatment. It's about ensuring that every medication serves a purpose and outweighs its potential risks. It's about finding the right balance between treating health conditions and avoiding unnecessary harm. For example, a senior might be prescribed a sleeping pill for insomnia. While it might provide temporary relief, long-term use can lead to dependence and increase the risk of falls. In such cases, deprescribing the sleeping pill and exploring non-medication approaches to sleep might be more beneficial in the long run. Deprescribing should always be done under the guidance of a healthcare professional. They can assess the risks and benefits, create a safe tapering schedule, and monitor for any potential withdrawal symptoms. Open communication is the key to successful medication management. Effective medication management is a team effort. It requires open and clear communication between the patient, their caregivers, and all healthcare providers involved in their care. Imagine a scenario where a senior is seeing multiple specialists, each unaware of the medications prescribed by the others. This lack of communication can lead to duplicate prescriptions, drug interactions, and other avoidable problems. That's why it's essential to keep an updated list of all medications, including dosages and frequencies. This list should be shared with every doctor, pharmacist, and healthcare professional the senior interacts with. Furthermore, don't hesitate to ask questions. If something seems unclear, or if you have concerns about a particular medication, speak up. Your voice matters, and advocating for yourself or your loved one can make a significant difference in their health outcomes. Empowering seniors to take an active role in their medication management is crucial. When patients understand their medications, their purpose, and potential side effects, they're more likely to take them as prescribed and report any concerns promptly. Start by explaining the purpose of each medication in simple, easy to understand language. Use clear, concise terms and avoid medical jargon. For example, instead of saying this medication is an ACE inhibitor for hypertension, you could say, this pill helps lower your blood pressure. Encourage seniors to keep their medications organized. Pill organizers can be helpful in keeping track of multiple medications and dosages. Additionally, consider using a medication reminder app or setting alarms to prompt timely medication intake. Remember, knowledge is power. The more informed seniors are about their medications, the better equipped they'll be to manage their health effectively. Caregivers play a vital role in managing polypharmacy in the elderly. They often act as advocates, medication managers, and vigilant observers, ensuring that their loved ones are taking the right medications safely and effectively. Caregivers can assist with medication organization, provide reminders, and ensure medications are taken as prescribed. They can also monitor for any side effects or changes in the senior's condition and report them to the healthcare provider promptly. Furthermore, caregivers can play a crucial role in advocating for the senior during doctor's appointments. They can ask questions, clarify instructions, and ensure that the senior's voice is heard. The dedication and support of caregivers are invaluable in navigating the complexities of polypharmacy and ensuring the well-being of our aging loved ones. The right medicine in the right amount at the right time. In the journey of caring for our aging loved ones, it's essential to remember that more medicine isn't always better. The goal is to ensure they receive the right medicine in the right amount at the right time. By embracing regular medication reviews, open communication, and the support of healthcare professionals and caregivers, we can help seniors navigate the complexities of polypharmacy and live healthier, more fulfilling lives. And advocating for your loved ones can make all the difference. Thanks for joining me today. If you found this episode helpful, don't forget to subscribe and share it with those who may benefit. Stay tuned for more discussion on how to live healthier and longer lives.